Assalamualaikum guys, today we are discussing the humerus, that is the third long bone in the upper limb. It is a long bone, so it has an upper end, a shaft and a lower end. First of all, if we discuss the upper end consists of a head, this one. This is the head of the humerus, which will make joint with the glenoid cavity of the scapula. This is the shoulder joint. Moving forwards, the thing which attaches the head with the upper end is the anatomical neck. This is the anatomical neck of the humerus. Moving forwards, where the upper end attaches with the shaft, this one is the surgical neck. There are two tubercles. This one is the lesser tubercle and this hole is the greater tubercle. Greater tubercle has three pits for three muscles. The groove that is enclosed between this tubercle is the intertubercular sulcus. Inter between two tubercles and sulcus is a groove. This is also known as bicipital groove because the long head of bicep, when it comes from the supraclinoid tubercle, it comes here and it passes from the bicipital groove of the humerus. Secondly, the ascending branch of the circumflex humeral artery also passes from this. The contents of the bicipital groove hence are the long head of bicep and the ascending branch of anterior circumflex humeral artery, because at the surgical net the anterior circumflex and the posterior circumflex humeral artery wind around. Now moving forwards, if we see the bicipital groove, there is a medial lip and there is a lateral lip. The shaft consists of three borders. Number one, the medial lip of the bicipital groove goes downwards, forming the medial border, hence forming the medial supracondylar ridge. The lateral lip of the bicipital groove goes downwards, forming the anterior border. The lateral lip forms the anterior border, which is interrupted by a roughened area. This one, which is the deltoid tuberosity. The anterior border is not marked in the lower end of the shaft. If we see the lateral supracondylar ridge, if we follow it upwards or trace it upwards, it forms an oblique line and it is continuous with the greater tubercle of the humerus. There is also a spiral groove, this one. This is for the radial nerve. Next, the surfaces of the humerus are three. Between the anterior border and the medial border is the anteromedial surface, and between the anterior border and the lateral border is the anterolateral surface. Between the medial and lateral border is the posterior surface. Now moving forwards, the lower end consists of many bony marks. Number one, the trochlea is the pulley-shaped structure that will articulate with the trochlea of the ulna here, and this is the cap-like capitulum. The fossas here enclosed are at the lateral side. On the radial side, the capitulum and the radial fossa which articulates with the radius, and the trochlea and the coronoid process which attaches with the processes of the ulna to make the elbow joint. Posteriorly, there is a fossa that is known as the olecranon fossa that will articulate with the olecranon process of ulna, forming the elbow joint. Moving forwards, if we see the muscle attachments are from the subscapularis fossa. The subscapularis muscle originates and it is inserted on the lesser tubercle, and if we see the posterior aspect like this, Supraspinatus originates from here and it is attached on the greater tubercle here. The infraspinatus originates from here and it attaches on the second pit of the greater tubercle, and the teres minor here originates from here and it is inserted on the third pit of the greater tubercle. So, if we see, there are three pits for three muscles. Number one, supraspinatus, infraspinatus and the teres major. These all muscles from the anterior to posterior forms a rotator cuff around the head of the humerus like this, from posteriorly supraspinatus, infraspinatus and teres minor, and anteriorly the subscapularis. So the head of the humerus or the shoulder joint is supported by a rotator cuff that is formed by these four muscles. It is deficient inferiorly, so most of the displacements of the shoulder joint are inferiorly. Moving forwards, on the deltoid tuberosity is attached the deltoid muscle. There is attached also a muscle that is known as Coracobrachialis. Now moving forwards, on the lower half of the anterior aspect, the brachialis muscle is attached. Now if we see downwards, the medial epicondyle is known as the common flexor region, and a muscle pronator teres is attached from here, common flexor region of the forearm, which will go down. And the lateral epicondyle is also known as the common extensor region, and two muscles originate from here. Number 1, the brachioradialis, and number 2, the extensor carpi radialis longus. Posteriorly, enconius is attached here, and there are 3 heads of tricep. Number 1, on the oblique line is attached the lateral head of tricep, and from this posterior surface attached the medial head of tricep. There are 3 heads of triceps. Number 1, from the infraglenoid, the long head of tricep. Number 2, from the oblique line is the lateral head of tricep, and from the posterior surface the medial head of tricep. Tri means 3, the long head of tricep, the lateral head, and the medial head of tricep. If we see the clinicals, the most common fracture of the humerus is at the surgical neck of the humerus. Number 2 is the supracondylar fracture, where the supracondylar from before the epicondyles. The supracondylar fracture gives 2 fragments, the lower fragment and the upper fragment. The upper fragment is displaced anteriorly, and there is the brachial artery which is passing, and this upper displayed fragment occludes the brachial artery, forming a contracture that is the Walkman's ischemic contracture. Secondly, the displaced lower end may damage the median nerve or the radial nerve which is passing from the radial groove.